Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
Hi. Just wondering, it's been a while since I've been on the questions, but the one time I was hoping to get on, but I just heard you, Cameron, go through like AI kind of diagnosis about if there's a certain, like something that I'm missing. Like I've been on it since July and I was working on my diet and my mindfulness and stuff like that, but my story was about like 20 years ago. I first had my concussion. I know I don't have a concussion, but I have the still the symptoms from like the my memory and my neck getting dizzy. So like the dizziness or the eyes, so not knowing like those exercises or which ones I need to focus on more. So, do you understand what I'm saying? Like the one time you had one guy on and you had a list of questions that you had like and you said like an AI kind of diagnosis about what kind of area that he should be kind of focusing on.
He's referring to the symptom bucket that you do at CCMI.
Right. Is that what you want me to do?
Yeah. Is there time to do that now, or just...
Hold on, let me log in here.
It's not quite yet based on AI, but we may get there at some point.
Yeah,
just based on the evidence and kind of our clinical input.
Well, it's based on our data, but hold on, let me.
While he's looking at that, are you tracking your symptoms in the app to see kind of where they're at?
No, I haven't done it.
Okay. Because that sometimes I find, I wish I would have had it when I was going through the program, because then I could kind of see which ones were worse certain day, like where it was, referring back to, what did I do the day before, things like that. I just found that an interesting way also.
All right. In the past couple days, how would you rate your headache? 0 to 6?
Sorry, 3.
3?
Yeah.
Pressure in the head?
3.
Neck pain?
2.
Nauseousness?
0.
Dizziness?
1.
Blurred vision?
Yeah, like I was off and on. So 1, I guess 1.
Balance problems?
2.5. 2.
2. Sensitivity to light?
0.
Sensitivity to noise?
2.
Feeling slowed down?
3.
Fogginess?
Fogginess. 3. 3.
Not feeling right or not feeling like yourself?
3.
Difficulty concentrating?
2.
Difficulty remembering?
3.
Fatigue or low energy?
3.
Confusion?
1.
Drowsiness?
3.
Trouble falling asleep?
0.
More emotional?
2.
Irritable?
3.
Sadness?
2.
Nervous or anxious?
2.
All right. Any bets? Paul, Melinda, Nikki, you have any bets as to what it's going to show?
I have a pretty good idea. I'm going to wait till it shows it.
Ah, scared to lay it out, eh?
Oh, it's gonna say. I think it's gonna say more psych.
Psych is 3. So inflammatory gut hormones, neck, psych, mental health, autonomic, but they're all pretty high, right?
Pretty equal across the board, to be honest. Like you
Visual
can't.
and vestibular is low, but like everything else, like 2.2, 2.15, 1.97, like all 4 of these are pretty much there. So you've been in the program since when?
July.
July?
Yeah.
Where are you in it?
So yeah, like I worked through like the I haven't been doing as many hours now as I could have. That's part of it. I have to. At the beginning, I've gotten to like the. I'm just looking up here now. The more towards the end of the dizziness and the dysfunctional, but I haven't been consistent on those. I was working on my diet and the other parts, but yeah, I have some of the other exercise I've done too.
So I would stop there. Like I wouldn't even bother going much further forward, but I would go back
Yeah,
and go back to Melinda's section, Paul's section, kind of redo that whole point because you got inflammation, neck, mental health, and autonomic that are all there.
yeah,
And aside from neck, like I wouldn't worry about visual and vestibular exercises. That's really low for you. So it's really the foundational stuff that needs to be kind of reined in. So um and maybe get some neck treatment. Like if you have a good manual therapist that can help you with that,
yeah.
um, that would be my recommendation is just to go back and redo those components because your biggest issues are in the foundation.
Okay.
Cam, for our listeners and members here, could you maybe explain what this tool is for people who haven't seen it?
So this is our clinical software that we have at Complete Concussions. So this is something that we built about 10 years ago, and it's used by all 450 of our clinic locations. So it's the largest concussion data set in the world. It's the largest EMR system for concussion, and so um, this is basically like a symptom bucketer based on your symptom profile to be able to say these are the top causes just to help clinicians make better decisions as to how they're going to go with treatment. Obviously, it's a patient education tool as well, right? So we go through that, we see it, and then we can give some areas of focus, especially if somebody's kind of unsure of where to go next. But in this case, it's go back to the start. Like
Yeah.
there's still a lot of foundational issues that are kind of driving a lot of this.
Like when I do this very similar questionnaire with my patients in my practice, actually just on paper. It's the post concussion symptom questionnaire that's been
It's the
validated.
same one that's in our app too. Like if you
Yeah.
go to the Concussion Fix app, we have it there. Do your symptoms on a regular basis to kind of track how you're.
Yeah. What we don't do in the app is actually assign the buckets,
No.
right? We don't and at some point we will look at doing that, but we want to actually collect a little bit more data on the Concussion Fix members and create and roll it out, I think, in a more usable way. We also don't have to be careful. We don't want to put a diagnosis to anybody, or at least be anywhere close to even suggesting that. So ultimately, it's up to your clinician looking at your symptoms should ideally try to, in their mind, create and put you in this bucket, kind of create this checklist. But I agree with, based on my clinical experience, 100% with what Dr. Marshall said, is that you're kind of pretty even across the board, where you're probably going to have to do some work on each one of the levels. And when a person presents like that, we kind of say, okay, make sure that all the foundations are present. Have you gone through the course? Have you implemented each area of the course diligently and completely? But neck, diet, and working on the psychology would be the 3 kind of like top things that type of score would show me, because things like you have quite high on things like memory and concentration, and there's confusion. So there's a lot there, but that's kind of cognitive dysfunction, and cognitive dysfunction has a lot to do with psychology and the emotional side of things. So when I see majority of symptoms in that area, that makes me think that that's a really important place to start. So that would be just my kind of clinical experience.
And it's probably picking up the inflammatory component too, because cognitive issues can be related to that as
For
well.
sure.
So that's probably why. But I think it's a combination of those areas. So Just kind of go back, start again, be really diligent on each component, make sure you're being like 100% on diet when you get there. Are you exercising regularly?
But I'm at a gym twice a week now. I just started with that. And I get my headache goes up from it, but then it comes back.
Yeah, well, you should be staying below symptom threshold, right? And it should be steady state cardio, and it should be every day, not twice a week, every day.
Mm-hmm.
Yeah.
Right?
Yeah, I bike every day, but then I do
Do you get symptomatic off your biking?
No, it doesn't affect me at all. Biking.
Okay, good.
Interesting. Okay, well, that's neck probably if he's bouncing around.
Use that jumping, then my head goes up. But
Yeah, that's probably the neck. That's probably the neck side of that.
Mm-hmm.
I have hormonal issues, like my hormonal stuff is really out of whack.
Yeah.
Okay. Well.
Okay. Well, that's
action items right there. Go for it. Yeah. Get after it.
Okay. Thanks.
All right.
Okay.
We'll see ya. Let's do this. Let's do this in 3 months. We'll do it again. Come back and share with us. That's amazing. Thank you.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.